Okay, so you have a 29-year-old male who presents to you with a history of years of IV drug use and several episodes of endocarditis in the past. He's presenting today complaining of unilateral eye pain, gradual decrease in visual acuity over past 2 days, much worse today. He is also complaining of shortness of breath, fatigue, fever. He is hypotensive, he's tachycardic, he's hypoxic, and when you listen to the heart, you hear a hollow systolic murmur. When you look at the eye, you see chemosis, you see periorbital edema, you see hypopyon, which is right this layer. When you look at the eye, a layering by gravity in the eye and general haze. He has fever, he has pain with extraocular eye movements, and when you look with the ophthalmoscope, you see that you can't really see the posterior structures well, you just see a general haze. So what POCUS exams would you perform on this patient to come up with a differential diagnosis or narrow your differential diagnosis? So at a minimum, you would do a cardiac POCUS exam and you would do an eye POCUS exam. So let's start with the cardiac exam first, because your patient is, as you've identified, hopefully, your patient is in shock. So here is our subxiphoid view of the heart. I can tell it's subxiphoid because I see the liver right here. I see the right atrium here and right ventricle, left atrium and left ventricle. When I ask myself, is this congruent with how the patient presented? Yes, because the heart is very tachycardic. Its rate is regular, but it's fast. And that's in keeping with what his vital signs are. And we heard that hollow systolic murmur when we were examining him, and we can see that the culprit is right there. That is a vegetation on the tricuspid valve, which is very common with folks who are IV drug users who get endocarditis. And the reason for that is because the infected microorganisms, usually staph, is traveling through the veins to the right side of the heart first. So it lands on that tricuspid valve first and infects it. So this definitely gives us a hint that we're probably looking at endocarditis here with some eye involvement. Now we move on to our POCUS exam of the eye because our patient is complaining of eye pain with movement and decreased visual acuity. We can't assume that this is related to our suspected diagnosis of endocarditis because patients can present with more than one problem. So when we look at our POCUS exam, we have to look at just this exam objectively. What do we see, and not bring any other subjective thoughts into it. So we'll take this apart. What we do see is we see the lens, which is right there, that curved hyperechoic structure, and right there is the anterior eye. Posterior to that is the posterior eye, which should be predominantly fluid-filled. So its echogenicity should be anechoic. And posterior to that, we should see hyperechoic tissues or posterior enhancement, which we do see. So the posterior eye does have fluid within it, but if we look carefully, we can see that it's not completely anechoic, as we would expect in a normal, healthy eye. We can't see the retina of the eye. We can sort of see the posterior disc, but we really can't see very clearly what's going on in the very posterior part of the eye. And we do see these echoes, internal echoes, peripherally kind of obscuring things. They appear, again, to move with the wall of the eye and not swirling independently with movement. So what do we think this is? It's endophthalmitis, which is an infection of the globe of the eye. And if it's endophthalmitis, it means that it was spread systemically from a systemic infection, which fits with our picture of endocarditis resulting in endophthalmitis. How do we know that it's endophthalmitis and not something else like a vitreous hemorrhage? So here's an example of what a vitreous hemorrhage actually looks like. You can see it's quite different. When the first thing that should really strike you, and we always talk about this in our POCUS sessions in the lecture parts, go with your echogenicities. If you look at this compared to what we saw in the previous slide, the actual fluid within the eye is very anechoic. It's not hypoechoic. There aren't particles in there that are making it look gray. The fluid part that we see is very anechoic, and that's a huge difference right there. And then moving on, comparing echogenicities against that anechoic presentation, we see these very hyperechoic structures more in the center of the eye, and they kind of, some of them look like little dots, and as the person moves their eye back and forth, that echogenic material, very hyperechoic, swirls back and forth very freely. It's very mobile. Whereas the other slide, the echogenic material was hypoechoic. It seemed to be adhering to the wall more. It was definitely more in the periphery, and it moved with the wall, like it was attached to the wall. It didn't freely move within the fluid of the posterior eye. So just comparing, we can see that a vitreous hemorrhage looks quite different than an infection inside the eye. I'm not going to attempt to pronounce the proper term for that because I already butchered it once. So if we compare side by side a vitreous hemorrhage with endophthalmitis, we can see that, again, in the vitreous hemorrhage, the predominant echogenicity of the posterior eye is anechoic, and that the internal echoes are very hyperechoic, and they swirl independently and are not adhered to the posterior wall. Versus endophthalmitis, let me turn that video on for you, which is right here, we can see very clearly that the posterior eye, you really, in comparison, it's not anechoic. It's very hypoechoic. Even in the very center where there's less of the collection of infection, it's still gray. It's not completely anechoic, not completely black. So it's hazy, much more indicative of an infective process. And you can see that the predominant infected material is more peripheral and moving with the wall. It's not moving independently, so we would say the collection is not mobile. So again, that makes it very clear, if you compare them side by side, the difference between vitreous hemorrhage and endophthalmitis. So here are some basics about endophthalmitis. It is an